Imagine living a healthy, full life, working in healthcare, taking care of your family, believing you are making the right choice for your future. Then suddenly, everything changes. Brittany Burnette, a mother and healthcare worker, got the COVID vaccine like so many of us did. But what happened next? A devastating cascade of medical complications. Clotting disorders, bone death, heart issues, and now kidney failure, and so much more. Her story is one of survival, resilience, and an ongoing battle for healing and for her life. This is a conversation you don't want to miss. Welcome to Navigating the Unknown with Nikki, a podcast in collaboration with React19. Together we share stories, support, and hope for those living with vaccine injury and chronic conditions. Welcome back to Navigating the Unknown with Nikki. This is where real people share their stories of life after vaccine injury. I'm your host, Nikki, and today's guest is someone whose background feels eerily close to mine. Brittany Burnette and I share striking similarities leading up to getting our vaccine. We both were healthcare workers, she a nurse, I'm a physical therapist. We live and work in the same areas. We're both moms, both about the same age when we got our vaccine, and received our doses at nearly the exact same time. And like so many others, we were both injured. But while there are common threads in vaccine injuries like inflammatory issues, autoimmune reactions, circulatory, gastrointestinal, neurological dysfunction, each case, though, unfolds differently. This is making treatment an ongoing challenge, making it even more important for us to share our stories, to find insight from others, and make connections for support and encouragement. Because this journey is a hard one. Brittany's journey has definitely been a hard one and continues to be. It has been one of relentless battles, multiple surgeries, and a fight for survival. Today, she is here to share her story, her struggles, and her hope. So, Brittany, let's start at the beginning. Tell us a little bit about yourself before the vaccine. What were you doing, and what made you decide to get the vaccine?
So I decided early on in my life that I wanted to pursue a career of nursing and to take care of other people. I graduated with my bachelor's from nursing in December of 2013. I married my high school sweetheart right out of college as well, and we started our life together. I have two young children, two boys, 10 and 6, and they're the reason I keep going every day. So, I was definitely born to be a caretaker, a mother, a wife and a friend and a nurse. I just always knew that that's what I wanted to do, was to take care of others. And so anyways, I tried out different areas of nursing before I found my true love, which was taking care of the elderly, the geriatric population, and working with staff members. I started as an assistant director of nursing and quickly got a job as a director of nursing at a skilled nursing facility. And I never thought that that's what I was called to do, but that is definitely what God wanted me to do, was to be there and to support my staff. And I think it was all preparing me for being a director of nursing during the pandemic, because it truly changed the face of nursing forever.
So, what made you decide to get the vaccine? Like, what was going on when all this started in the facility or the place that you were working at?
So we closely watched, like, as the pandemic, it was overseas at first, and then, slowly trickled its way down to our area. And honestly, I just felt a sense of responsibility to my the care of the people that I provided for in the geriatric and a skilled nursing facility, like that, to help protect them from this virus that was just it was killing people left and right, especially with how, immunocompromised that population is. And also, we didn't know, like, for my family, like, I stayed with a friend during an outbreak we had at our facility because I was scared to death to bring it home to my family. And I mean, I lived at the facility having to make makeshift units to protect the ones that didn't have it from the ones that did, because the hospitals were maxed out. I mean, so we had to, take care in house and for what like supplies we had available, because there was such a shortage at the time that you couldn't even get the supplies you needed. So you just had to work with what you got. And I mean, I missed my son's birthday, and which I chose, that's things I chose to do. But these family members weren't able to see their loved ones anymore. And so we were the only thing, that the closest thing they had whenever they felt so alone, being so sick. And so my goal was just to make sure that these people that had COVID, knew that they weren't alone, even if they were, dying, like they weren't going to die alone, that someone was always there that cared. So like I said, it changed the nursing so much for me. Like, yeah, I felt like the whole time that God had been preparing me to take on something like that and to support my staff members. I mean, I can't tell you, like, that my staff members throughout the whole thing they were phenomenal. They never gave up. And it just goes to show you that these people really do care about people, you know, in life. I mean, yes, of course, there are some that you find bad eggs everywhere, but like for the most part, it was it's life changing. But so I felt that sense of responsibility to get the vaccine. Now, and we were told that we could lose our Medicaid and Medicare funding if our staff members were not vaccinated, and I could lose my job because I was the leader of the facility for nursing. And so most of the staff members looked to me for the choice on whether or not to do it. And to get a religious exemption at that time, it was so hard. I mean, it still is hard, but it was even harder then to find any
Right.
than not to. And, I did know that I had hypertrophic cardiomyopathy. It's a genetic heart condition I was born with. I did know at that time that I had that. And my cardiologist at the time, whenever I called his office just to make sure that it was safe for me to get it, on his recording had a preset recording telling all of his patients, if you're calling to ask that, just get it, like a blanket order, which is
Nick,
crazy because,
that is crazy.
what happened to individualized care,
I know. And real quick, for everybody that doesn't know what the hypertrophic cardiomyopathy is, enlarged heart
Yes,
is, okay.
enlarged
And
heart.
and a lot of people have this, don't even know they have it, no symptoms. Sometimes, of course, it does pop up and it does cause issues, especially like in athletes. I hear it from an athletic training background. Kid doesn't know they have it, and sometimes the muscle of the heart can get so large it does cause heart issues and
Right.
could cause death. But a lot of people have it no problem.
Yes, yeah, they do. And I just happened to find out that I had the genetic form. Whenever I was pregnant with my second child, I started having like chest pain, things like that. And they did like cardiac enzymes, and it flagged. And long story short, they ended up sending me to St. Thomas in Nashville. And we found out that I had the hypertrophic cardiomyopathy after they did an echocardiogram, which is an ultrasound of the heart. And so once they did that and found out I had that, we've kind of just done maintenance on it. And I never really had that. I mean, I had a couple exasperations of episodes where I would have chest pain and I would have to get it looked at and checked out and stuff, but nothing like after I got COVID and the COVID vaccine. Like it made it 50 times worse, my heart episodes. So.
What were you experiencing? When did they begin? But hold on, let's backtrack. I forgot. When did you get your vaccine? And what vaccine did you get?
Yes, I got the Pfizer vaccine, and I got the first dose in January, on January 11th of 2021. And then I got the second dose on February 1st of 2021. And so I had COVID initially, that actually on Thanksgiving the year before, on November 2020. So it was kind of like, I mean, even though my doctors knew that I had or had the virus, just less than 2 months earlier, they still said that there was no problem with me getting the vaccine in January and the second dose in February.
Uh-huh. And, I hear now a lot of people are having more issues, it tends to be when they do have COVID and the vaccine, or they have COVID after they get the vaccine, that it's causing even a more compounded effect. And it's horrible to think, such as the answering machine message from the cardiologist. They gave us all these blanketed reassurances, and we trusted them. They were people that we thought had our best interest. So it was a difficult situation. And I too experienced some of that same thing. It wasn't required when I got it, but it pretty much was coming down the chain that if the company I wanted to work for, any provider wanted to see Medicare, Medicaid patients, if your staff was not fully vaccinated, they would lose funding. So essentially, they couldn't do business. So you as an employee had to get the vaccine, and it was just a matter of time. And after I experienced everything, I even got a letter saying I was required to have it before I returned to work because of that. But it is, you see these, and I worked, even though I did home health, I worked in different facilities like a memory care unit and things like that. And it was horrible to see the people in isolation, family members not seeing them, and the ones that were COVID positive, even more the isolation. And it was heartbreaking, and you were scared. I sent my kids to stay with their dad for a good month when it was unknown what was going on because people were dying, and you see it firsthand, and there was no rhyme or reason sometimes whether they had comorbidities, they didn't, they did okay, no problems, or they did horrible. And that was a scary factor.
It was.
So back to my question now, you've got the vaccine. When did your symptoms start? What were you experiencing?
So I got the vaccine, and then I started experiencing like chest tightness, heaviness, burning whenever I took deep breaths. And so I went to the ER in Paducah, because that's where my cardiologist now was at the time. And Dr. Stephen Broussard, he's wonderful. And he uh, found out through, like, he came in and took care of me and found out that I had the pericarditis and pleurisy based on my symptoms. But I was also having bilateral hip pain at that time, which he referred me to see Orthopedic Institute in Paducah. So that's kind of, they did prescribe me a small dose of steroids for about 6 weeks. But because I had, because sometimes avascular necrosis can be caused from steroid treatment. So sometimes I feel like doctors are quick to say, oh, well, that's why you got the avascular necrosis. But my hip pain had developed before that treatment even had started. So I like to to bring that forward
Absolutely.
first thing. Yes, right. So I'm not dismissed, because I feel like sometimes I'm so quickly dismissed about little things. And so, anyways, I went to the Orthopedic Institute, and essentially after imaging and care done there, that they determined that it was just arthritis of my hips. And at that point, I was in a wheelchair because the pain was so bad whenever I walked in my hips. I couldn't bear weight. I mean, it was like nothing I had ever experienced. And I was an active, at that time, 31. I was on my feet all the time, working as a nurse and being involved in the daily care. And to go from that to being in a wheelchair, I mean, it was it was a big deal. I feel like I have a pretty high pain tolerance too. So it was unbearable pain, that bone pain. So my mom, she has been she has been my biggest advocate throughout this whole thing. She was the one that was like, no, we're going to get another opinion. We are making our own appointment at Vanderbilt, and we're just going to be sure, that that's what's happening and that's what we're dealing with, because you should not be in a wheelchair. And so anyway, she made an appointment with me, at Vanderbilt, and we went and down there, and they reviewed my imaging, and immediately they were like, the only treatment that you have available is total hip replacement. Your hips, it's avascular necrosis, and your hips have collapsed on both sides. And so, and by the time that they were able to get in there and do my hips, I mean, he said he had to scrape the bone out because it was so inflamed. And for the recovery, like just to kind of compare, someone that has a normal hip replacement, they said that if someone that's experienced avascular necrosis, the inflammation is double the amount of those with just normal arthritis that have to have a hip replacement because of how inflamed and how aggravated that tissue is around, and that with that bone collapsing and everything. So it takes, I just can't compare myself to a normal hip replacement or shoulder, knee, whatever, so
No.
because it's hard, especially when you see these elderly patients bebopping through and making it through faster whenever I'm, 30 something years old, because it takes so much longer for me to bounce back. But I felt like I did pretty good for my situation. So I was able to do for my hips, at least, therapy online, and do it at home. I did have to go in for my other ones, but at least I was able to start out doing that, because that's
Right.
such a major change to have to do and dedication to go through.
Yes, it is. We're going to come back to the bone stuff. I wanted to touch base on something you said at the beginning. You said pericarditis. You had pericarditis. I know a lot of people out here, we hear myocarditis a lot, and, it's been talked about, and people having that after the vaccine. Could you, from a nurse's standpoint, explain what is the difference between that myocarditis and what you were diagnosed as pericarditis?
Okay. So myocarditis is the actual inflammation of the heart muscle itself. Pericarditis is inflammation of the membrane surrounding the heart. So that's kind of like the difference between the two. And then pleurisy is the inflammation of the lungs. So I had a combination of, the pericarditis and the pleurisy whenever they started my treatment for that, whenever I went in for the chest pain.
Yes, see, it's all linked. Whenever you hear that itis at the end of the word, that means inflammation. So it just depends on where that inflammation is.
Right, exactly.
And this is a huge common thread, the inflammatory process and it going crazy in our body. And it depends on the person where it attacks.
Right.
And obviously yours was a lot more for the bone and the heart issues. And then it caused a whole lot of other issues
Right.
too.
Clotting, all the things, right?
And now going to the bone stuff. You mentioned the avascular necrosis. I know, a little extra information for all of you out there from a PT standpoint. I saw a few patients that did experience avascular necrosis, usually the ones that are your age or younger. Those are the ones that are kind of having a congenital or a birth issue where blood vessels aren't supplying the actual hip bone. And what happens is you have your socket and then you have your big long femur bone and it fits in. And as you move, it kind of goes in there. There's a cushion between. But with avascular necrosis, that blood supply, because bone needs blood, that blood supply is damaged or obstructed in some way. And because of that, your bone starts to die. And when it starts to die, part of it collapses down. And so now you don't have this smooth bone and it's trying to move. And it is extremely painful because of the nerves and the bone death. And you're right, depending on why you go into a joint replacement and the damage that was already done and the amount of work that they have to do and your body's ability to heal because you've already got that inflamed state throughout your body, it makes it very difficult. And so for your avascular necrosis, obviously there was lack of blood supply to it. So kind of give us a little background of what led to this.
What led
Such as the clotting disorder you were telling me about earlier when we talked.
Okay, so I do have a clotting disorder. We found out through, I have seen so many specialists and had every, test. I've had endocrinology, rheumatology, hematology, and so I saw a hematologist. I'm sorry, I'm trying to keep it all straight for you. I saw a hematologist in November of 2023, at Vanderbilt. She's wonderful. And she did a ton of like routine, I guess, panels that she normally does for clotting disorders and genetic disorders. Well, I've triggered to have a factor 8 disorder. So there's like two different or a few different types, but like the two major ones is the hemophilia type and then the opposite where your blood is too thick. And that's the one I have. I have the factor 8 disorder where my blood is just so thick that it puts it at risk to forming clots a lot higher than a normal person. So I have to be on a small dose of blood thinner every day. So that's just like the standard course of treatment. And then I just follow up with her and have routine labs done regularly. But it does, I mean, I will always, even though I'm taking the blood thinner, be at a high risk of forming clots. So what essentially, I saw a geneticist at Vanderbilt. I guess it was in 2022, I think. And he said that what he thinks happened is that whenever I got the vaccine, with having, that clotting disorder, that even though it was kind of dormant in my body, I had only had one other instance of a clotting episode before all of this, that it activated it and kind of sent out an immuno response where my body started attacking itself and sending out thousands of clots all over my body, which in turn cut off the blood supply to my bones and my joints, and then led to them dying and collapsing. And sometimes that with people, you can catch it in early stages, but unfortunately with mine, every time by the time we like catch mine and get to it, and which we have been super prompt, still it's already died and collapsed. So it's early recognition. It's so important. Mhm.
It is. And I definitely want to reemphasize the fact because I have several people say this to me. Well, you have something that was already going on before, and it was just coincidence that it activated at this point or it became an issue at this point. Yeah, that could be the issue for some, but there is a huge, huge number of people that are seeing these coincidences, and it's hard to believe they are.
Exactly.
Because not only is the vaccine causing this crazy response, but obviously for some people compared to others, people are like, well, I did it. I was fine. My mom did it or my friend did it, that they were fine after the vaccine. So it was just you already had that going on.
Yeah.
Well, the thing is, whether it is causing new issues or activating things that we're genetically predisposed to, there's an issue with reaction. And it is not suitable for all, obviously,
Right.
because of these issues that, people have different disorders that may not be activated at all the rest of their life. Or they may have it later on in life, which still gives you better quality and longevity of life. So this in itself is an injury. It's an adverse effect. And with that, I mean, how many, we talked about the hips. You had the bilateral or the both sides of your hips replaced. Oh, talk about all these other things, because I know you have gone through multiple surgeries, and where has it led to other bone death in your body?
So I've had both of my hips replaced. Then after my hips, my knees started dying and collapsing. So I've had both of my knees replaced. And I can go into more detail about dates and stuff if you need me to. But then I've also had both shoulders. Now I only have had them partially replaced because I'm so young. I need a full replacement. But if a partial replacement will do for now, then that's what they're going to do, because these joints only last for a certain amount of time. So I'm going
Yep.
to eventually have to have them replaced again due to, an update or like the material that's they implanted in my body. I've also and had 3 elbow surgeries on my right elbow. I still haven't had it replaced because they're trying to avoid that, because once I have my elbow replaced, I will not even be able to lift a jug of milk for the rest of my life. I mean,
Nope.
of course, right-handed. And so what they've done, the most recent one was resection of the radial head. So they just took out the radial head and left it out, and didn't put any, anything, implanted, back into it. So I just kind of had to adjust to not having that additional support like most people do in their arm. But thank heavens the Vanderbilt, orthopedic physicians have been amazing. They, they have taken care of me, and done whatever they had to help with the pain and with the orthopedic surgeries and everything. Um, I was trying to think about my heel on my left side. I didn't have to have surgery, on it, but it just broke while I was walking. So that was able to heal on its own, thank heavens. But currently right now, my right foot is broke, and like the ball of the top of your foot right there, and it's fractured across. And so it's not healing though, because I've been in a boot for, gosh, I guess 2 months now. And so, yeah, so I have to have surgery on Monday, and they're going to go in and put a plate in and do a bone graft and possibly fuse, some things together. But the thing is like, even though I have all these replacements and these surgeries and everything, there is still so much bone pain due from the inflammation and the death of that bone around
Yes.
that area. Like, yes, it fixes the neurotic, I'm sorry, necrotic pain, but it doesn't like fix all of the pain altogether. Like, I suffer on a daily basis from pain. I mean, it is all consuming how bad it is. I mean, there's some days that it's everything I have to just get out of the bed, and be a mother. I can't drive my kids to school anymore, especially right now because my right foot's broken. And there are just some days my bones, they just don't even want to move. And my body just can't. So it's just, it's been a lot. So.
Pain, people think, I even had patients, they're surprised at the pain that they're having after a replacement. And this is just for people with like arthritic pain and osteoarthritis. And, I don't think people are fully educated in the fact that, yes, it is a new joint, but they literally go in and saw your bone off and screw it and put it back together and hammer some place that, a new material in it. And it causes intentional damage.
Right.
And with that, it creates inflammatory response. So now not only are you dealing with that normal healing, but you already have that predisposed position to having more inflammation, and you don't have good blood supply throughout your body because of this clotting disorder obstructing things. So what do we need to heal? We need good blood supply to bring in fresh blood, fresh cells, remove the waste and get it out for, and everything like that. So it creates more pain. And even people that are able to get past that rehab and get to a point where they're moving, even people with OA, they still will tell you, hey, I know when it's going to rain. The winter, cold affects it because it does. The different pressures in the air, it is not your natural body. And so it does. So then you add in everything you're going through and it makes it a complete storm. And honestly, with all the joints that you've had affected and, they're large joints, the ones you use, we're not talking about one limb. We're not talking about just the legs. We're talking about the arms, the legs, and throughout your body. And honestly, I don't know how you deal with the pain daily and be able to do that. How do you, and there are people out there that are experiencing a lot of pain. I've gone through times where I have, and then it will subside some, and neuropathy, stuff like that. But do you have any tips for people dealing with pain? How do you do it?
My biggest tip is to advocate for yourself. There's such a, you know, discrepancy, or like, there are some people that just write you off. Oh, she's just seeking, pain meds type thing. Like, you
Uh-huh.
feel that. And I mean, it's so highly regulated. I mean, you have to advocate for yourself, because if you don't, then you will be written off. I mean, I have been blessed with a great pain management physician at Vanderbilt that I recently acquired. She's phenomenal. I mean, she makes sure that I'm able to, just have the best quality of life possible, because before that, my primary care was taking care of my pain. And I've tried herbal remedies, I've tried the acupuncture, I've tried physical therapy. I mean, I've tried everything
Right.
you can try to help control pain. uh, and so it just is mentally so trying. I mean, therapy is a great thing. I mean, I'm a great, I'm a full advocate for therapy. Like, your mental, or whatever gets mentally, you get affected and damaged just as much as you do physically. So to have that support in that aspect, I mean, having a support system is so important. And unfortunately, there's lots of people that don't. And so if you can find a support system, whether it be a physician or it be a therapist or it be a family member or a friend, you know, I just feel like that's so, so important, because if you don't push for yourself, I would have been written off a long time ago, and I would be miserable, and I wouldn't be able to function. I mean, I am on disability now because I can't, like, I have to have so many surgeries, and I can't work. I can't be a nurse. I can't be on my feet because of how bad the pain is, day in and day out. Like you said, some days are much worse than others. I mean, there's so many different factors that go into it that you have to choose your battles, but it's just, I mean, it's so important to have the support system. And of course, without God and prayer and, having faith in yourself, to know that you're not alone in this, like, to find a community, like I said, for support, because that's so important to not feel alone.
Uh-huh. I agree. I agree completely. You definitely need support. And when it comes to pain symptoms, well, no matter what's going on, you know, some people say, well, your tolerance is low, or it's in your head. Well, let me explain something. Yes, technically it is in our heads, because if we didn't have a brain, we wouldn't feel pain.
Right.
Our brain processes the pain, and it processes it differently. And when you add in factors of fatigue or sickness, or, anything else, or emotionally, like when you're depressed or anxious, guess what it's going to do? It's not going to be able to buffer and handle that pain that you're experiencing, and that your body is saying, hey, I've got pain. So now with these other factors, you can't control it as much. And so it is even more heightened. And, I was talking to a doctor. They have more people in the ER at night. Why? Because we start to relax. We start to, not be distracted by other things. And it doesn't mean that you aren't having as much pain during the day, but now all you can focus on is the pain. And you can't distract it. You can't buffer it out. And it becomes a huge thing that can overpower you. And it is very, very important to try to keep your mind as healthy as you can emotionally, because it's a huge factor on how much pain you can tolerate and how much you feel. And, it's easier said than done. You can't say, well, I don't want to feel pain. So, or, I want to be at a life that I can live, and flip a switch. It doesn't happen that way. And I do believe that therapy is a great thing. I've gone through some of it myself to kind of cope with this new life that I'm having to live. Thankfully, I've had some, local support through my partner. My kids have been awesome, but it's huge. You have to have a support
You
network.
want the
And
life that you are going to have. I mean, it truly is a mourning process, because you have to understand and accept. that you have to see a new reality for yourself because it's not always what you hoped it was going to be or wanted it to be. Um, so, which you just have to, I mean, I know it's easy to say, "I'll just make the best of the situation," but until you live that and
Right.
understand your new reality, I mean, it 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 it's devastating.
It is, and I believe it's not only important to have that extra support of friends and family, but also to connect with people that have gone through similar situations. Maybe our injuries aren't the same, but we're both experiencing debilitating things that cause major limitations in our life. And with that, we all experience having to grieve that life that we once had and lost and trying to find quality in the new life we have. And we get each other. We understand it. We understand some of the thoughts that pop up. We understand the struggles, the daily life. You may be good this day, may be horrible the next, may be good at the beginning of the day, may be horrible at the end of the day. It is a constant battle of uncertainty. And that in itself creates stress.
Right. And you see the people around you, their lives are just going on and moving
Right.
forward and you're stuck. And you don't want to hinder or hold anybody back or and but you are in a constant state of pain and unknown when you have something like this, and it's so hard if you don't have people that can relate to that because people can, someone can say all day that they understand, but until you actually live what someone is going through like that, I mean, you can't fathom it, and I wouldn't wish it on them. I
No,
don't
no.
want to hold somebody else back because of what I'm going through and what I'm struggling with and the pain I'm experiencing, especially my family. I I want my boys to have the most normal life possible and not
Right.
miss out because mommy can't take me from point A to point B or take me to school or go to watch my
Right.
soccer game or baseball game,
Mm-hmm.
or practice football in the yard, whatever it may be. It's just
Yeah.
it truly is so hard as a mother and a wife, like, just to have that support system or from your partner, whoever, because I mean, I wouldn't be able to do this without them. I
No.
would have, I feel like falling in a dark hole if it was, they are the light. They are what leads me forward, gives me the strength. And it's just, it's a lot for them to bear, but I feel like in the end that they will be the most compassionate and understanding as to what my goal is for them. I feel so blessed that God gave me such a, strong community like that.
And it's very important to have that. And I feel so bad for the people that don't have those close people in their family or friend support system, a spouse, a partner, kids to pretty much motivate you on days where you don't think you can. Guess what? As a mom, you have that innate drive to be like, yes, I can. I'm going to do it somehow. And with that comes so much burden and stress. And I know there have been plenty of times where I've had to miss things of my kids, and it makes you feel guilty. It makes you feel like a failure as a mother,
Exactly.
and you feel like not only is it affecting me, but it is affecting my kids and my spouse, and you feel like a burden, and it's hard because it's not just you as the injured, it's the whole family that's feeling it.
Exactly. I completely agree.
It is. And I will say, I definitely 100% agree with you. Faith has carried me far. So no matter what your faith, what your
Right.
spiritual aspect is, I will say for me, I still believe in miracles, and I still believe he knows a lot more than anybody down here. And he's going to lead me the right direction in the places I need. And to this point, I feel taken care of, and I know it's beyond this world of the care and the blessings that I've received, even in the hardest of times, and it's been a huge part of my healing. So, he talked about the family and the impacts on it. And how has it been adjusting to not being able to work? Not, you went to schooling for this. You've pretty much saw this was your lifelong career, and this is what you were going to do as a nurse. And, you were even director at, one point. And now it's all gone. And it seems like it may not be a thing that you can return to at that. So how does that impact you?
It is, like I said before, I mean, I have truly had to mourn the life that I thought I was going to have. I have always been a go-getter. I want to be, the best of the best I can be for me, for my family, for my patients. I am such a caretaker, so it's been a major adjustment to go from being the caretaker to being the one that's being taken care of, because I don't ask for help well. I am very independent. So it has been so humbling to have the roles reversed. I mean, to be the patient whenever you've been used to being the caregiver. So
Mm-hmm.
I can't really describe it. It's so hard. It's almost impossible, but just whenever you feel like it's impossible and you're not going to be able to do it, you do. I mean, you just do it, and you make the impossible possible and push through. And I'm just going to have to accept that I may not ever get to be what I thought I was going to be nursing wise, and even a mother and a wife, but I will do the best I can with what I have, because I have to. I mean, my husband and my family, they deserve the best of me no matter what state I am. I may not be 100%, but at least I'll give 100% of the 75% I am able to give.
That's right.
So it's just, I, I truly, I mean, I can't say anything else other than you are mourning, the life you thought you were going to have. I mean, it's a loss. It's a grieving process. And you just have to learn to accept it because it's your new reality. You don't have a choice.
All right. I think it's very important, you know, like we said, as a mother, we do have motivating factors. We have our children. And, even though you want to wring their neck sometimes, mine are all teenagers. One just turned 18, but it is, you are motivated that you can't give up because somebody is depending on you, and they love you and they need you as a part of their life in whatever capacity you can give. So you try to give it, just like you said, 100% of that 75% that you can give, because that's what you can give that day and in that moment. And so for people that don't have that, that's why it's huge. It's important to help find purpose, to find what your motivating factor is, because it is very easy to throw in the towel without having something in the back of your head that is inspiring you and motivating you. And I don't mean this is a every minute of the day, every day thing, because there are plenty of times where I do not have motivation. I will sit in my little pity party, and that is completely fine because you need that.
Right.
That is
That,
all a part of the grieving process and dealing with anything chronic in nature medically. You have to go in those situations and you have to go through them. But the key is to be able to bring yourself out of it, because you don't want to get stuck in that negative feedback, because what it's going to do ultimately, it's going to take you down here, and eventually this affects your whole body, and it can even slow healing and slow the process of you getting better or feeling better that day. So it's very important. So if you don't have that motivating factor and you don't know what it is, for everyone, you've got to help find that. And sometimes you have to do it through therapy to be able to help you find that purpose.
right. You use
Yeah.
through all avenues, um, help that you can get.
Yeah. And so, we talked about this. You talked about the clotting disorder, the pain, the bone pain, the bone death, the replacements, the multiple surgeries, the fractures. And I understand, this has gone on throughout. This has been 4 years. I have to do my math. 4 years since all this started. and it is still going on. You're still experiencing these things. And from what you told me, you're experiencing or have experienced some other stuff too, in addition to that. What's that?
I see rheumatology now because they're treating me for like just different autoimmune things. Like even though I tested negative for lupus, they are treating me as if I were to have lupus. So they and RA as well. Because of the way my body has like kind of started attacking itself, that autoimmune, type treatment. So I've done chemo injections. I've done the immunosuppressant therapy. I've done infusions. And now I'm on the hydroplaquenil and just different. They're trying to figure out what the best avenue to treat this unknownness that that they've never experienced before, because this is a new thing for them as well. So it's kind of like a trial type thing to figure out what works best, because this is like with it being like, because I've never had issues before COVID and COVID vaccine with my immune system like this. So it's totally affected that as well. And my bones, back to that, they're still like I said, my right foot now, it just broke walking or fractured walking. And I didn't injure it. I didn't do anything. And so now I'm having to have surgery with that. So it's just like, even though, it may have slowed down a little bit, I'm still suffering every day. And I just literally wake up and will have a bone hurting. And there's nothing like that necrotic bone pain death. Like I know exactly what it is when it happens. And, you have to go through all the hoops and hurdles with insurance. Like, even though I have this history, I still have to start with an x-ray every time. Most of the time, the x-ray doesn't show it. So then once you get the negative x-ray, then you have to go to the MRI, which is the more accurate. And I mean, I can almost every single surgery replacement I have had, whenever they get in there, it is so much worse than the MRI even showed. Like the bone depth is way more extensive. The bone, the tissue around it. I've had bone in my elbow start to regrow around where the bone depth was, and which also wasn't shown in the MRI. So it's just it I don't see an end in sight yet, which I never thought that I would still be doing, this 4 years, later. So it's very discouraging sometimes whenever you don't know if there will ever be an end, to what you're experiencing in this pain. It's there. It's just, there's not anything like it.
No, there's not. And that is, you bring up a good point, that I experience a lot of times. You feel like there is no end in sight. You might take a step forward, you take two back, or you might think you're doing good, and then bam, it's horrible. And it is a never ending roller coaster. And I remember it took me about a year before it really sunk in that this could be my life. And at that point, I was still trying to cope with it and figure it out. And it's very disheartening to think I have to live this way the rest of my life, especially when you're in your worst moments, to think about dealing this with the rest of your life. And it's hard, because you don't know how, not only did I lose everything, but can I tolerate this? Can I tolerate this level? Can I tolerate these symptoms? Can I do it? And it's hard. It is a complete mental battle daily. And at the moment I've been doing good, but now my fear is, can I live this way? But now my fear is, when is that piano going to drop from the sky and change everything?
Right, exactly.
Because with autoimmune inflammatory things where your body systemically all over is attacking itself, things may change in a matter of half a day or a morning when you wake up.
Right.
It can change and you never know. And that uncertainty kills you.
It does, and, like, with my immune system, being so out of whack and distraught, like, for instance, um I got sick a few weeks ago. I guess it was back in December, and we thought it was just a bug. And I didn't have any normal UTI symptoms. I don't have history of UTIs since high school. I might have had one, but I mean, it's been 10, 15 years, and then within a week, I went to the ER because I couldn't even stand or lift my head. I had a knot on the back of my neck the size of a softball that was a ball of inflammation, they said. But we went to the ER because I couldn't stand or move or see. And whenever, like, cause I was seeing things, and when I got there, I was in kidney failure and septic shock. And I mean, they have no idea why. They don't know why my kidneys failed so fast. They said if I would have waited another day, I probably would have died. So they ended up having to aerovac me to a bigger hospital that yeah, admitted me to their cardiac ICU because I had to be on a cardiac drip, because my blood pressure was bottoming out from being in septic shock. Well, nowadays, people don't stay in the hospital very long, and I was in there almost 2 weeks, because it was so bad. It's just, and that happened out of nowhere. Like, I was fine, and then I just wasn't, and it wasn't even bone related. This was a whole nother ball game that now I have to see an infectious disease specialist, and it's just crazy how my life was so normal 10 years ago, and now it's just, I literally live day to day not knowing what could happen, you know, next, which, everybody has their own stuff. I completely agree. Everybody has their own health and everything, but it's so much scarier when you are that weak and that just alone. I don't know how to explain it.
It
Susceptible, I
is.
guess.
Yeah, I mean, everybody has stresses and worries of how they're going to do, what's going to happen. But when you have something like this, an autoimmune, chronic illness, condition, vaccine injury, everything is so uncertain.
Exactly.
And especially with vaccine injury or some of the chronic conditions where they're not finding answers, you don't know what's going to happen because it is so little understood about what's going on. And, that causes us issues in finding medical care and finding advice. There are some that write us off, obviously, and ignore the fact. And then there are some that honestly, truly want to help and are good people, doctors, but they don't know because there's not enough research and knowledge out there. Medicine, we only know so much. That's why we continually research and improve. And it's just not known very well. And so it's hard to find answers. And so you have uncertainty of what exactly is going on. What's the prognosis? Everybody says, okay, I have cancer. Now, what's the prognosis? With a lot of times they have all this data of people that have had that type of cancer before. And, what is their prognosis of getting better, getting worse, dying? What is it? Well, we're looking at a new world. We don't understand the prognosis because we haven't studied it.
Oh, right.
And it's hard. And now you have to further deal with the unknown, and it makes you think, what's going to happen next? Where is this going to go? Is this going to be my life? What is it? And I to me myself, I have CIDP, which is chronic inflammatory demyelinating polyneuropathy. So it's like the chronic form of Guillain-Barré. So with Guillain-Barré, more people are familiar with that. You get really bad, and then you slowly start to improve. Well, with CIDP, you have cycles of up and down, and you can have times where you're better or worse or things like that, but it's lifelong. And because of that, the inflammatory issue, just like you and so many other, we have that autoimmune inflammatory response, and they're trying out these immunosuppressants, things to make our system not be in hyperdrive and start attacking itself and only attack things that it needs to attack and make our immune system healthy. And you try natural stuff, you try all sorts of things, you try different medications, immunosuppressants, but it's literally trial and error. Knowing the fact that this is a lifelong thing that is completely uncertain what the next day, what the next month, what the next year you're going to look like, or what you're going to be able to do. And it's hard. It really is. So, yes, everything is uncertain. And, obviously you are still dealing with a lot. You mentioned that the recent kidney failure, and you've got, that going on, the bone stuff, and the heart stuff. So anything else that's been going on or that you've had since all of this initially started?
Well, yeah, actually, in October of last year, I have always had the hypertrophic cardiomyopathy, but since COVID and the vaccine, it has gotten so much worse. Like all the symptoms, the condition itself is worsened in my body, and like for instance, I was driving one morning, and I had just dropped my kids off at school, and I had just like a little stomach virus the day before or a couple days before, and so whenever I was driving, I fainted. Thank heavens I had just dropped my kids off, but it caused me to have a heart episode where one of the symptoms of my heart condition is to faint, because you get that arrhythmia type thing. And so I fainted while I was driving and had a car accident, and I was air evac to Vanderbilt because they thought I had a brain bleed and was going to die. So that unknown, as my parents and my husband are driving, to Nashville to find out whether or not I'm going to make it. I mean, just putting my family through things like that is just, you feel so responsible and guilty, even though you have no control over it.
Right.
This has truly changed my life and my family's life. I mean, it affects so many people around me, my friends, my family, that have gone out of their way to be there for me and to do that, to help me every day in and day out. It was just, I think that changed my family forever that day. It was one of the scariest things throughout this whole thing that I have been through. It goes to show that, just that this one virus and vaccine can change your life. In an instant. It's just wild.
It is. When you experience, or the people that love you dearly experience it with you, something that could be life or death, it changes you as a person.
It does.
You see things different, you experience things different, and we tend to find value in even the smallest of things. And it's hard because I've talked about this with other people. What doesn't seem like a huge achievement and worth celebrating at all because it's a normal day thing to somebody else is a huge thing. To get a shower at one point was a huge thing to me.
Yeah.
If I could tolerate getting a shower and put on normal clothes instead of pajamas, it was a good day. And you
Right.
think, well,
Or to do
what?
those things without having to have someone help you. Just even
Right.
brush your teeth or brush your hair, like
Mhm.
little things like that you take for granted, let alone picking up your child whenever they get hurt and telling them, mommy's here, it's okay. Like little things like that you take for granted, you can't do, that are taken away from you and can't do. It's just, people need to understand how it just is so hard.
It is. It is. So, in closing our episode, what if you could give the people listening, maybe in similar shoes as you and I, what words of encouragement, hope, advice, what would you leave them with today?
Just to not give up. Advocate for yourself. Get the second, third opinion, doctor's opinion. Don't, just because the first one writes you off or even the second one writes you off, if you truly feel like something is going on, trust your gut, advocate for yourself, because nobody, I mean, you are your own best advocate. Nobody else is going to do that for you. And if you push and keep trying, you will get there. You will find the answers, hopefully, that you're looking for, even if it takes 4 to 8 years, eventually, hopefully that you'll find the answer, and hopefully someday there will be some sort of, compensation or something to help these people after all we've been put through and dealt with, from being, on the front line, especially people like you and I, that were on the front line, willing to give our life for others. And it's just, don't give up. I mean, that's the best thing. I know that's little and small, and people say that kind of stuff all the time, but it's the truth. You just need to believe in yourself and advocate for yourself until the end. I mean, until you can't anymore.
I believe you're absolutely correct. Advocating is a huge thing. And if you did miss our last episode, anybody watching this, I talked with another nurse about advocacy and the importance of that, because it's huge, especially with something so little known. It's important to get that second opinion and make sure you're doing what you should be doing.
Exactly.
So definitely be an advocate. Good advice. Absolutely. But Brittany, thank you so much for being on today, sharing your story. It has definitely been a hard one and continues to be, but finding those little moments of hope and encouragement are huge. And I want to thank you for sharing that story
Yes,
today.
and thank you for the opportunity to share my story. I appreciate it.
Absolutely. And for all those that are wanting to and able to donate, Brittany has a personal fundraising account to cover medical expenses, and the link is Give, Send, Go, and I'll put the link in the description below. Brittany, thank you so much for sharing your story, your strength, your insight. I know this journey has not been easy, but your voice is going to help so many others feel seen, heard, and less alone. If you're vaccine injured and want to share your story to encourage and inspire others, I'd like to hear from you. This podcast is all about offering hope, and I'm currently pre-recording episodes to release throughout the year. Like many of us today, I take advantage of the good days and get as much done as possible, so you never know what tomorrow's going to bring. That's why I'm doing all this pre-recording and getting them scheduled. So if you're interested, visit the website www.vaccineinjuryhealing.com. That's www.vaccineinjuryhealing.com. There'll be a link in the description, and you're going to fill out the guest request form with some information. And so please bear with me. I'm a one-woman show, and I will get back to you as soon as possible. And before you go, make sure to check out the other episodes in the podcast playlist and hit subscribe so you don't miss any future episodes and stories of resilience, healing, and hope. And thank you again for listening, and I will see you in the next episode.